The first time Karen Delaney felt it, she thought it was just her age catching up with her. It was 2:14 a.m. according to the glowing red numbers on her bedside clock. The house was silent, the kind of heavy, suburban silence that comes after the last car has driven by and the last TV has been switched off. Karen, 54, lay on her side, half asleep, when something deep behind her left ear gave a slow, deliberate crawl. Her eyes flew open. Not a sting. Not a throb. A movement, like a tiny finger pushing from inside her skin, and then slowly dragging away. Heart pounding, she reached back and pressed her fingertips behind her ear. There, at the edge of her hairline, she felt it, a small, raised lump the size of a pea, warm and tender. When she pressed slightly, something inside shifted, just enough to make her stomach twist. She scrambled out of bed and flicked on the bathroom light. The harsh white glow washed over the mirror as she swept her gray-streaked hair aside. Just behind her ear, close to the jawline, a swollen bump bulged under the skin, faintly red with a tiny dark center like a clogged pore. "It's just a pimple," she whispered to her reflection, forcing a shaky laugh. "Or a bug bite. Nothing." But as she watched, the lump gave a faint, almost polite twitch, as if something inside had just turned over and gone back to sleep. By morning, the night felt like a bad dream. Karen tied her hair into a loose bun, slid on her glasses, and shuffled into the kitchen. The coffee maker gurgled to life while the local news murmured in the background. Outside, her quiet Ohio street was waking up. Trash truck, school bus, dog walkers. Ordinary. She balanced her mug in one hand and her laptop in the other, settling at the small dining table she used as her home office. As she slipped on her headset for the first Zoom meeting of the day, the padded band pressed right across the tender spot behind her ear. A sharp sting shot down her neck. "Damn," she hissed, flinching. She adjusted the band, trying to ignore the throb. During a lull between calls, she snapped a quick selfie of the side of her face and texted it to her younger sister, Jenna. "Karen, tell me this doesn't look gross. Probably just a zit from hell, right? Jenna, LOL, stress pimple. Welcome to your 50s. Put some cream on it." Karen smirked and set the phone down, rubbing the lump with the side of her finger. It felt a little bigger. Or maybe she was just thinking about it too much. "It's fine," she muttered, opening her emails as the headset nudged the same spot again, making the hidden thing under her skin quietly protest. By late afternoon, it stopped feeling fine. Karen stood in the bathroom again, this time under softer daylight leaking through the frosted window. She pulled her hair aside and leaned closer to the mirror. The lump was no longer a pea. It was closer to a marble now, pushing the skin out in a smooth, tense curve. The redness had deepened into an angry blush, and the tiny dark spot in the center looked larger, like the tip of something had pressed up and then retreated. She swallowed. Up close, the skin around it seemed shiny, stretched a little too tight. When she tilted her head, she could see the outline of the swelling moving with her jaw. "Great," she muttered. "Perfect. Just what I need." She opened the medicine cabinet, grabbed an old tube of antibiotic cream, and dabbed a generous layer over the spot. Then she covered it with a small bandage, pressing it down gently. "I'll give it a couple days," she told her reflection, forcing a calm she didn't feel. "If it's still there by the weekend, I'll go in." But as she turned off the light and walked away, the bandage pulsed softly against her skin, like something underneath had just shifted to make room. That night, the house felt too quiet. Karen stood in the steamy bathroom, towel wrapped around her, comb dragging through damp gray-blonde hair. The shower had left a thin fog on the mirror, softening her features, blurring the edges of reality in a way that made her feel both younger and oddly unreal. Her fingers brushed the bandage behind her ear. The area throbbed, a slow, dull ache that matched the rhythm of her heartbeat. With a small sigh, she peeled the bandage away. The adhesive tugged at her skin, and she winced as the swollen area was exposed to the cool air. She wiped a circle of steam from the mirror and leaned in. The lump was bigger. Definitely bigger. The skin looked glossy, stretched thin over the raised knot of flesh. The dark spot in the center had widened into a tiny, shallow pit, ringed with irritated pink. "Okay," she whispered, her chest tightening. "That is not cute." She reached up with her fingertips and pressed lightly around it, more out of morbid curiosity than anything else. Something inside shifted. Not just a throb. Not just a pulse. It rolled, slowly, deliberately, like something alive repositioning itself in a cramped space. Karen jerked her hand away, breath catching in her throat. For half a second, she swore she saw the skin itself give a faint wave, like the surface of water touched by a breeze. Her pulse hammered in her ears. She stared, unblinking, at her reflection. Did I just see that?" she whispered. She stood there, counting seconds in her head. 10, 20, 30. The lump stayed still. No ripple. No wave. Just an ugly swelling behind the ear of a tired middle-aged woman who spent too many hours staring at a screen. Karen let out a shaky laugh that sounded nothing like herself. "It's just blood flow," she told the mirror, nodding as if that somehow made it true. "Or a nerve twitch. I'm probably making it worse by poking at it." She dabbed a fresh layer of cream on the area, covered it with a new bandage, and turned off the bathroom light. As she walked down the hallway toward her bedroom, a phantom sensation brushed along the side of her neck, like something inside that lump was slowly, patiently stretching. The next day the itch started. It wasn't on the surface, where a fingernail could reach. It was deeper, buried under skin and bone, like a tiny wire being pulled slowly through the flesh behind her ear. Karen tried to ignore it through emails, through calls, through the clatter of her keyboard, but by evening it had sharpened into a hot, needling burn. By the time she went back to the bathroom, her hands were already shaking. She peeled off the bandage, heart drumming. The lump looked angrier now, more swollen, the skin around it flushed and tender. A faint ring of dried yellow crust circled the dark opening. "Come on," she murmured. "Drain already, would you?" She grabbed a clean tissue, folded it, and pressed gently on the sides of the swelling. Pain shot up her neck. The tiny opening in the center yawned just a little wider. For a heartbeat, nothing happened. Then something pale and slick pushed out, a narrow, wet tip like the end of a white thread or the head of a tiny worm, glistening under the bathroom light. It flexed once, tasting the air, then slid back inside so fast she almost doubted she'd seen it. Karen dropped the tissue. "Oh my God," she whispered, backing away from the mirror as the room tilted. "There is something inside me." Karen wasn't sure how long she sat curled on the edge of her bed, hugging her knees and trying to breathe normally. The house was quiet, the sun had dipped low, and shadows stretched across the carpet like dark fingers. She finally grabbed her phone with trembling hands and called the one person who always showed up, her childhood friend, Megan Walsh. "Megan, I need you to come over," Karen said the moment the call connected. Megan's voice sharpened. "What's wrong? You sound terrified." "It's behind my ear. Something's in there. I saw it. I saw it move." Within 20 minutes, Megan burst through the front door without knocking, still wearing her work scrubs from the assisted living center. She dropped her bag, hurried over, and gently tucked Karen's hair behind her ear. The second Megan saw the swelling, her breath hitched. "Karen, this doesn't look like a pimple." "No kidding," Karen whispered. Megan leaned closer. The small pit in the center had widened, ringed by shiny redness and faint yellow fluid. A sour, metallic smell escaped it, barely noticeable, but enough to make Megan's face tighten. "Have you been messing with it?" she asked. "Not really. I mean, I pressed it once. Then it just opened. And something," her voice cracked. "Something came out." Megan didn't waste another second. "Get your shoes. We're going to the hospital." Karen blinked. "But it's probably expensive. And I don't even know if—" "No," Megan said firmly, grabbing her purse and the car keys from the counter. "This isn't optional. Whatever this is, it's not normal, and you are not sitting home with it." The tone left no room for argument. Karen followed her out to the driveway, clutching her coat tight as the cold Ohio night wrapped around them. During the car ride, every bump in the road sent a fresh surge of pain behind her ear. Megan glanced over between streetlights, jaw tense. "You're going to be okay," she said, though her voice sounded like she was trying to convince herself to. Karen didn't answer. She just squeezed her eyes shut and wished the thing inside her would stop moving. The emergency room was buzzing in that tired, fluorescent way, TV murmuring in the corner, a toddler crying somewhere down the hall, the sharp smell of antiseptic hanging over plastic chairs and worn linoleum. Megan checked them in at the desk while Karen pressed a folded napkin behind her ear, trying not to wince. When the triage nurse finally called her name, Karen followed Megan into a small cubicle curtained off from the rest of the chaos. The nurse, Alicia, snapped on gloves and tilted Karen's head gently to the side. "Fast-growing lump behind the ear," Alicia muttered as she typed into the computer. "How long has it been there?" "A few days," Karen said. "But tonight I saw something move. Inside." Alicia's eyebrows lifted, but only for a second. "Sometimes when there's fluid or pressure, people feel pulsing or shifting. Pretty common with abscesses." A resident physician, Dr. Colin Marks, stepped in a few minutes later, chart in hand. He repeated the exam, pressing around the lump with practiced fingers. Yeah, this looks like an infected cyst or abscess, he said. We'll numb it, open it a bit, drain it. You'll feel a lot better. But it moved, Karen insisted, voice tight. I saw something come out and go back in. Dr. Marks offered a calm, tired smile, the kind that said he'd heard every version of fear before. What you probably saw was a little plug or clotted material shifting when the pressure changed, he said. It can look weird, I know. But this is very routine. Routine. The word sat in Karen's chest like a stone as they wheeled her toward a small procedure room, the pain behind her ear throbbing in time with every step. The procedure room was colder than the rest of the ER. Karen lay on a narrow table under a bright overhead lamp, the paper sheet crinkling under her with every small movement. A metal tray beside her held lined-up instruments, syringe, scalpel, gauze, forceps, small stainless steel basin, all quietly waiting. Megan stood near the head of the table, one hand resting on Karen's shoulder. Nurse Alicia swabbed the skin behind Karen's ear with a chilly antiseptic that smelled like hospital and alcohol wipes and old memories. You're going to feel a quick sting, okay? She said softly. Dr. Marks leaned in with the syringe. Deep breath for me, Ms. Delaney. Karen squeezed Megan's fingers and inhaled sharply as the needle slipped under her skin. The burning spread in a slow circle around the lump. First pain, then a strange, heavy numbness. Can you still feel this? Dr. Marks asked, pressing gently on the swollen bulge. Just pressure, Karen murmured. Good. That's what we want. He picked up a small scalpel, its blade catching the light. Megan shifted her weight, eyes fixed on the floor tiles now instead of the instruments. Tiny incision, Dr. Marks said, more for the nurse's chart than for Karen. We'll drain the abscess, flush the cavity, pack it if we need to. Karen felt a dull push as he made the cut. No sharp pain, just an uncomfortable tug. A warm wetness slid down the side of her neck. Thick purulent drainage, Alicia narrated quietly while she pressed gauze to catch the flow. Yellow-white, moderate amount. Karen swallowed hard. Everything okay? She asked, voice small. Looks exactly like an abscess should look, Dr. Marks replied. You're doing great. He widened the opening slightly with a sterile instrument, then picked up the suction tip. The soft hiss filled the tiny room as he cleared the fluid, pausing to press around the base of the lump to express more. For a few moments, it was just clinical routine, press, drain, wipe, suction. Megan finally looked up, cautiously, just in time to see Dr. Marks reach for a pair of fine, curved forceps. Sometimes there's a little core of material in these, he explained. Like a plug. I'm just going to see if there's anything solid in the center. He slipped the forceps into the small opening behind Karen's ear. Karen felt it as a distant pressure, like someone exploring a sore tooth that had gone numb. She focused on Megan's face, watching her friend's jaw set tighter the deeper the forceps went. Got something, Dr. Marks murmured. Feels like a small solid piece. He tightened his grip and slowly drew the instrument back. What emerged wasn't solid. Something long and pale slid out of the incision, glistening under the overhead light, a soft, off-white body with faint ridges, still slick with fluid. It wriggled weakly between the tips of the forceps, curling toward the air like it was searching for somewhere else to burrow. Alicia gasped, the sound sharp in the cramped room. Megan slapped a hand over her mouth, eyes flying wide. Karen didn't see it at first, but she heard everything, the sudden silence, the way everyone's breathing changed. What? Karen demanded, panic cracking her voice. What is it? What did you pull out? Dr. Marks stared at the small, squirming thing for a single stunned heartbeat, his professional mask slipping. That is not a plug, he said quietly. He dropped it into the stainless steel basin with a wet tap. It twitched there, curling on itself, very much alive. Karen tried to sit up, but Megan pressed her gently back down. Stay still, Megan whispered, though her own voice trembled. Karen, just breathe. I told you, Karen choked out, tears pricking her eyes. I told you something was moving in there. The room felt smaller after that. No one said anything for a few seconds. The only sounds were the soft drip of something into a trash can and the faint rattle of the air vent. Dr. Marks swallowed, tore his gaze away from the basin, and forced his voice back into something resembling control. Alicia, I need that specimen in pathology right away, he said. Label it as urgent. Possible parasitic organism. Alicia nodded quickly, still a little pale, and moved to cover the basin. Karen's fingers dug into the edge of the table. Wait. Possible? She demanded. You just pulled a living thing out of my head. That's not possible. That's... I know, Dr. Marks said. His eyes were different now, no longer amused, no longer dismissive. You were right. This isn't a typical abscess. I'm going to irrigate the cavity thoroughly and see if there's anything else in there, okay? He slipped the forceps back into the incision, moving more cautiously this time. He flushed saline into the opening and suctioned it out, watching with grim focus. A second pale shape slid toward the opening, smaller than the first. He caught it before it disappeared again and drew it out, laying it next to the first in the basin. Megan made a choked sound and looked away. Karen felt the room tilt. How many of those are in me? She whispered. We don't know yet, Dr. Marks said honestly. That's why we're going to keep you here and run some imaging. This isn't something we can treat as an outpatient infection. He finished flushing and packing the wound, taped a pressure dressing over it, and then stepped back, stripping off his gloves. Ms. Delaney, have you traveled outside the country recently? Camping? Any exposure to livestock, wild animals, or, you mentioned gardening on your intake form. Yeah, Karen said, brain scrambling. I haven't left the country, but I do a lot of gardening. Compost, mulch, I feed stray cats by the fence sometimes. There's raccoons, possums, all kinds of things back there. Dr. Marks nodded slowly, processing. Okay, he said. We're going to admit you for observation. I'll order a CT scan, and maybe an ultrasound of the area around your ear and neck. We need to make sure there aren't other pockets or lesions. Megan squeezed Karen's hand. What does that mean? She asked quietly. Other nests? It means, Dr. Marks replied carefully, that if there's more, we want to find them before they find us. They moved Karen upstairs a few hours later, long after the bustle of the ER had blurred into a haze of beeping monitors and rolling gurneys. Her room on the medical floor was dim and quiet, lit by a single wall lamp and the steady green blink of the heart monitor. And 4 line trailed from her hand to a bag of fluids. Bandage tape tugged at the skin behind her ear every time she shifted. Megan sat in the visitor chair by the window, scrolling through her phone with the volume turned all the way down. Every so often, she'd glance over at Karen just to make sure she was still breathing normally. Karen stared at the ceiling tiles. Even with the bandage on, she swore she could still feel it, the memory of movement. Every tiny throb of her pulse near the incision made her skin crawl. A nurse came in at some point to check her vitals and hang a bag of 4 antibiotics. Another came to draw blood. The night moved in strange, broken chunks. Around 3 in the morning, Karen jolted awake with her hand clawing at her own neck. In her dream, the basin from the procedure room had been sitting on her kitchen table, filled not with 7 or 8, but with dozens of pale, writhing bodies all trying to climb out. She'd watched them drag themselves over the metal lip and drop to the floor, disappearing into the cracks of her hardwood. Now, in the darkness of the hospital room, her fingers dug into the bandage as if she could rip everything out by herself. Karen. Megan was suddenly there, catching her wrist, her voice low and urgent. Hey, you're okay. You're here. Stop, you'll rip it. Karen blinked, disoriented. The monitor beside her bed beeped a little faster. I can feel them, she whispered. I know that sounds crazy, but I can still feel them. Megan didn't argue. She just held her hand until the shaking slowed. Morning came with harsh daylight and the clatter of breakfast trays in the hallway. A transport aide arrived to wheel Karen down for imaging, a calm woman with kind eyes named Lydia. The CT scan room was cold and clinical. Karen lay on the narrow table as the machine hummed and clicked around her head, a robotic halo capturing slices of whatever nightmare had been living under her skin. Later, in a small consultation room, Dr. Marks returned, this time with an older Yenti surgeon, Dr. Amelia Cross, whose calm gray eyes took in Karen in a single sweep. They had the images up on the screen. This is the area behind your left ear, Dr. Cross said, pointing with a pen. You can see the incision site here. Now, these small oval pockets around it, these are what concern us. Karen squinted. Even she could make out several tiny, irregular shadows clustered like seeds around the site. How many? Megan asked, arms folded tightly across her chest. At least 4 distinct cavities we can clearly identify, Dr. Cross replied. Possibly a 5th deeper, but it's hard to differentiate from normal tissue on this scan. And you already removed 2 things, Karen said slowly. From just one spot. Dr. Marks nodded. That suggests there may be multiple organisms, or remnants, still present under the skin. We've also sent the first specimen to pathology for identification, but that may take some time. Dr. Cross folded her hands. Ms. Delaney, I'm recommending surgery, she said. We need to open this area more extensively, explore the tissues, and remove anything that doesn't belong there. Leaving it could risk ongoing infection, spread into deeper tissue, or, given the location, potential involvement of the bone, inner ear structures, or in rare cases, even the brain. The word brain landed like a weight. Karen licked her lips. Are you saying this could get into my head? In most cases it doesn't, Dr. Cross answered honestly. But given what we've already seen, I don't want to gamble with most cases when it's this close to critical structures. She slid a clipboard toward Karen, the consent form already clipped in place. This form explains the risks, Dr. Cross continued. Bleeding, infection, damage to nearby nerves, possible hearing changes, scarring. In very rare instances, more serious complications. The goal is to remove every visible abnormal pocket and anything like what Dr. Marks extracted last night. Karen stared at the lines of small, printed text without really seeing them. What happens if you miss one? She asked. Dr. Cross held her gaze steadily. We'll do everything we can not to. But biology isn't always neat. Sometimes organisms die off after partial removal, especially with treatment. Sometimes they don't. That's why we'll also be involving infectious disease specialists and medication afterward. Karen's hand shook as she reached for the pen. Megan covered her other hand with hers. I'm not going anywhere, she said softly. I'll be here when you wake up. The signature Karen scratched onto the paper hardly looked like her own. The operating room felt like another planet. Bright, white light. Stainless steel. Blue drapes. Voices behind masks. Karen drifted in and out of the pre-op haze as the anesthesiologist, Dr. Nguyen, attached monitors and adjusted lines. Someone settled a padded ring under her head to support her neck at just the right angle. You're going to feel sleepy very soon, Dr. Nguyen said gently. Just think about somewhere you'd rather be. Karen tried to picture her backyard in spring, the raised beds, the flowers, the little stone birdbath where robins splashed in shallow water. For the first time, the image made her stomach turn. As the anesthesia washed over her, the last thing she felt was the cool brush of a gloved hand tucking her hair away from the area behind her ear. Then the lights and voices slid away. Dr. Cross stood over the draped field, her eyes now the only visible part of her face. Incision, she said. The scalpel traced a longer, curved line behind Karen's ear, following the natural crease of the skin. Carefully, layer by layer, Dr. Cross opened the tissue, her movements precise and deliberate. Suction. The surgical tech guided the suction tip into place as a thin thread of blood clouded the saline. Under the magnifying loops, the deeper structures of muscle and connective tissue came into focus. Here's the primary cavity, Dr. Cross murmured. You can see where they drained it last night. The space was partially collapsed but still irregular, its lining thickened and angry. She began to gently explore around it with a blunt probe. There, she said suddenly. Small satellite pocket at 2 o'clock. Using fine forceps, she widened the tiny side cavity. Something pale glistened just under the thin wall. With slow, controlled motion, she grasped it and drew it out. The second larva was shorter than the ER specimen but thicker, its segmented body curling reflexively as it left its hiding place. It landed in the metal dish with a soft, sickening tap. That's 3 removed, including the ER one, the scrub nurse announced. Dr. Cross didn't respond. She was already probing deeper. Another pocket here, she said after a moment. Lateral, near the mastoid surface. Very close to the bone. The fourth organism did not come out easily. It was anchored deeper, its surrounding tissue inflamed. As she pulled, the body stretched grotesquely before releasing with a tiny, stubborn snap. 4. She continued. The fifth came from a pocket she almost missed, tucked behind a strand of fibrous tissue. The sixth emerged from a deeper channel, twisted like it had been crawling along a path towards something more vital. Each time the count rose. That's 5. 6. The basin beside her tray, lined with sterile gauze, now held a small collection of limp, pale bodies, some intact, some damaged by extraction. Once they had all been moving. Now they lay still, as if the lights above were the sun they had crawled toward and never reached. Skin showed at least 4 pockets. Dr. Cross said between steps, more to herself than to anyone else. We've exceeded that number. She paused, comparing memory to reality. Let's irrigate again. They flushed the wound thoroughly, suctioning away blood and debris. Dr. Cross traced every visible angle, following the bone, the muscle planes, the subtle shifts of color that marked the difference between healthy and invaded. There's a small irregularity here, she said at last, near the deepest part of the field. Could be another cavity, or just scarred tissue. She probed gently. The area resisted, dangerously close to structures she did not want to disturb. If there's one more, the scrub nurse said quietly, it might be there. Dr. Cross didn't answer immediately. She pictured the CT images. The hazy shadow that might have been a fifth or sixth lesion. The count they'd just made. How many total? She asked. Including last night's specimen, the nurse said. We're at 7. 7. Dr. Cross held her tool still, her mind weighing risk and reward. If she cut deeper and there was nothing, she could damage nerves, blood vessels, bone. If she didn't, and something remained, it might mean another surgery or worse. At this depth, she said finally, we're approaching critical structures. I don't feel a distinct cavity here, just thickened tissue. If there is something microscopic left, antibiotics, and the immune system may be able to handle it. She withdrew the probe slowly. As far as I can see, she said, more firmly this time, we've cleared every visible abnormal pocket and removed 7 organisms. Documenting 7 specimens, the nurse replied, writing on a label. Sending all to pathology. Dr. Cross took one last, long look into the open wound, then began the careful process of closing what they'd opened. Layer by layer, she stitched the tissues back together, her movements as precise in repair as they had been in destruction. When they were done, only a long, curved line of sutures and a padded dressing remained to show where the invasion had been. Underscore 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 underscore. Karen surfaced from anesthesia to the sound of something beeping steadily nearby and a cool weight pressed against the side of her head. Her throat felt dry. Her tongue felt too big. Karen, a voice said gently. Hey, you're in recovery, okay? Surgery's over. She blinked, vision resolving into Megan's face hovering above her, eyes glossy with relief. Behind Megan, Dr. Cross appeared, mask removed now, expression calm. How did it go? Karen croaked. We found more than we were expecting, Dr. Cross said. In total, counting what Dr. Marks removed in the ER, we took out 7 of these organisms. 7, Karen repeated, the number landing in her chest with a strange mix of horror and relief. All gone. We removed every visible one we could find, Dr. Cross said carefully. The area was thoroughly explored and irrigated. We've also started you on targeted medication to cover the most likely parasites while we wait for pathology to confirm exactly what they are. Karen stared up at the ceiling for a moment. How does something like that even happen? She whispered. I never left Ohio. Some parasites don't care about borders, Dr. Cross said. They can be carried by soil, insects, animals. The infectious disease team will talk to you more, but based on what we saw, this is a rare presentation of a larval infestation that usually doesn't make it this far. Most people never see more than one. You're unfortunate. Lucky, Megan cut in. She's lucky you caught them. Dr. Cross inclined her head. Also that you insisted she come in. She rested a hand lightly on the rail of the bed. The next few days are about healing, she said. We'll monitor for infection, check your labs, and keep an eye on your neurological and hearing status. So far, everything looks stable. She didn't say perfect. She didn't promise never again. But the word 7 echoed in Karen's mind anyway, like a tally carved into a wall she hadn't known she was trapped behind. Underscore 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 underscore. Hospital days blurred into each other. There were dressing changes that stung despite gentle hands. Nurses sliding gloved fingers under the edge of the bandage to check for warmth, for swelling, for anything that suggested the enemy was regrouping. There were pills in tiny paper cups and 4 bags that ran dry, replaced with new ones that hung like strange fruit from their metal tree. Every time someone peeled back the dressing, Karen looked away. I don't want to see it, she told Megan once. Not yet. You're healing, Megan replied. It looks better every day. Don't lie to me, Karen said weakly. I'm not, Megan insisted. It's just, stitches, bruising. But no more movement. No more guests. In the quiet hours of the night, when the hallway lights dimmed and the nurses' voices fell to murmurs, Karen lay there and tried to convince herself that the phantom sensations she felt, little tickles, small pulses, were just normal post-surgical nerves regrowing. Her brain, however, replayed the basin in the oar. 7. On the third day, Dr. Cross stood at the foot of her bed with a small stack of papers and a more relaxed expression. "Your labs are improving," she said. "No signs of systemic infection. Pathology confirmed that what we removed were indeed larvae of a fly species, usually associated with animals and certain outdoor environments. It's rare in humans and rarer still in this location and number." "So I was a—" Karen grimaced. "Unwilling host," Dr. Cross supplied. "But not anymore. The medication course we've started will help make sure anything microscopic that might have been left behind doesn't get a second chance." "And my ear? My brain?" Karen asked. "Everything okay?" "Your hearing tests are normal," Dr. Cross said. "Your neurological exam is clean. The scar will be noticeable at first, but should fade over time. You'll need follow-up appointments, but from where I'm standing, you're stable enough to go home tomorrow if there are no changes tonight." Home. The word felt both comforting and terrifying. When discharge came, it came with a folder full of instructions, a list of medications, warning signs to watch for, and a follow-up appointment scheduled in 3 weeks. "Call us," the nurse said as she wheeled Karen toward the elevator, "if you have fever, sudden pain, new swelling, or anything that feels off." Karen almost laughed. Everything felt off. Underscore 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 underscore. Back home, the familiar smell of coffee grounds and lemon cleaner greeted her like an old friend trying too hard. Megan helped her ease onto the couch, propping her up with pillows so the bandaged side of her head wouldn't press against anything. The house was quiet. Too quiet. "I can stay tonight," Megan offered. Karen shook her head gently. "You have an early shift tomorrow." "I'll be okay. I have my phone. I have instructions. I have 7 fewer problems than I did." Megan hesitated, then nodded. "Text me if you so much as sneeze weird," she said, pointing a finger toward her. "I mean it." When the door closed behind her, the silence Karen had once loved about her little house turned into something else. Every creak of the floorboards was amplified. The hum of the refrigerator sounded like distant buzzing. That night, sleep came in jagged pieces. In one dream, she stood at her bathroom mirror again, only this time, when she peeled back the bandage, the incision had become a round, open hole. Something on the other side watched her back, blinking slowly. She woke up clawing at her neck, heart racing, the phantom sensation of crawling spreading like ink across her skin. "Stop," she whispered to herself in the dark. "They're gone. They're gone. They're gone." And yet, at random moments, pouring coffee, rinsing a dish, walking past the hallway mirror, she'd feel a faint, impossible sensation behind her ear, like a memory trapped in the nerves. Sometimes she fought the urge to check. Other times she lost. One afternoon, a few days after coming home, she stood in the bathroom with the small hand mirror angled, just right so she could see the healing incision behind her ear in the larger mirror. The stitches ran in a neat, curved line, the skin around them still yellowed and bruised. "It looks good," she told herself, though the puckered flesh made her stomach clench. "It's just a scar. That's all." In her mind, the basin in the oar flashed again, 7 pale bodies on gauze. She closed the mirrors and turned away. Underscore 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 underscore. 3 weeks later, she sat in the Yenti Clinic exam room, paper crinkling under her as she swung her feet gently. Dr. Cross came in with a small tablet and a warm nod. "How have you been feeling?" she asked. "Physically?" Karen shrugged. "Tender. Little sore. But no fever, no weird swelling. The incision seems okay. My hearing's fine. I can sleep on that side again, sort of." "And otherwise?" Dr. Cross prompted. Karen hesitated. "I've had some nightmares," she admitted. "Sometimes I feel like something's crawling when I know it's not. My therapist says it's trauma. That my brain is trying to make sense of it." "That's a very normal response," Dr. Cross said. "Something invaded your body. We removed it. Your mind hasn't quite caught up with the fact that it's over." She put on gloves and gently inspected the scar, her touch clinical but careful. No signs of recurrent swelling, she said. The tissue looks healthy. The scar is healing well. I don't see any reason for concern today. Today, Karen repeated. Dr. Cross smiled faintly. Medicine is honest that way. We can tell you what we see today. The imaging we repeated this morning also looks reassuring. No obvious pockets, no fluid collections. I'd like to see you again in a few months, but if anything feels drastically different before then, call us. So for now, Karen said slowly, I'm okay. For now, Dr. Cross confirmed, you're okay. On the way out, Karen passed a row of chairs where other patients sat with their own invisible stories. For once, she didn't wonder what was hiding under their bandages. She already knew too much about what could hide under skin. Underscore 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 underscore. That night, back in her own bathroom, she stood in front of the mirror longer than usual. She didn't peel the scar back or prod it with curious fingers. She just traced its outline lightly, feeling the raised ridge under her touch. You're healing, she told herself. She turned her head side to side, letting her hair fall along the curve of her neck. The house was quiet. The clock in the hallway ticked steadily. And then, so soft she almost missed it, she felt it. A tiny flutter. Not sharp. Not painful. Just a single, delicate ripple under the skin near the bottom edge of the scar, like a muscle twitch or a heartbeat out of place. Karen froze, her finger pressed to the spot. For a full minute, she didn't move. Didn't breathe too deeply. Didn't blink. Nothing happened again. It's just nerves, she whispered, forcing the words out slowly. Just healing. That's what they said. Just healing. She dropped her hand, turned off the bathroom light, and walked down the hallway toward her bedroom. Behind her, in the darkness of the mirror she could no longer see, the faint outline of the scar seemed to pulse once, tiny, subtle, almost imaginary. Almost.